Welcome to this 5-minute introduction to Fusion Osteoinductive Bone Putty. Fusion is a combination of Synergy, a calcium phosphate synthetic, and DBM, real demineralized bone matrix, in a putty. Why a putty? Because the putty carrier keeps the graft in place. Unlike other putties, Fusion does not wash away with saline or water irrigation. Fusion is fast and easy to use. It comes in a truncated syringe like you see here and is stored at room temperature. No mixing or rehydrating is needed. Fusion is moldable and adaptable, which makes it perfect for placement into any site, even irregular or hard to reach defects. The putty is simply expressed out of the syringe and ready to apply to the defect site. Fusion is popular because it contains real bone as well as the Synergy synthetic. This results in faster bone healing. This is especially important in cases with older dogs or cases with severe bone loss. Osteoinductivity studies have shown that real bone contains BMPs that stimulate bone formation. Fusion is the only putty on the veterinary market containing real bone. Take a look at a direct comparison of the ingredients of Fusion Bone Putty versus the other putties available on the veterinary market today. All of the other putties available consist of bioglass. The problem with this is that the body cannot effectively resorb glass. Conversely, Synergy calcium phosphate synthetic, like real bone, is actually resorbed by the body and replaced by the patient's own new bone. Fusion comes in 0.5 cc, 1 cc, 2 cc, and 3 cc single patient doses. It can be stored at room temperature and has a 2-year shelf life. Fusion combines the latest technology in synthetic bone graft material with the gold standard of real bone graft, DBM, to provide the veterinary community with a technology that has evolved well beyond filling voids with glass particles. Orthopedic indications for the use of Fusion Bone Putty include the following: TTA and TPLO, fracture repair, angular limb deformities, non or delayed unions, arthrodesis, and filling and reconstruction of metaphyseal bone defects. Dental indications for the use of Fusion Bone Putty include void filling, extraction sites, periodontal pockets, bone loss, mandibular fracture repair, cysts and other osseous defects, and guided bone regeneration. Here are 2 step-by-step cases using Fusion, one in the mandible and one in the maxilla. You will find case studies and peer-reviewed publications in the case studies and references sections of our website. Someone is here at VTS 24/7 to answer any questions you may have. Our grafts are available directly from VTS and through distributors. Thank you for taking the time to learn about these bone graft products. Now is the time to join your colleagues in using the optimal product for the stimulation of bone healing in orthopedic patients.